Hi. So as I mentioned in the previous video, I'm going to talk of psoriasis. Psoriasis. So others, especially in Africa, pronounce it as psoriasis, but in here, so the P is silent. Psoriasis. So what is psoriasis? So this is basically a chronic. So this is a chronic autoimmune skin disease. Skin disease. Skin disease. Skin disease. That accelerates the growth. Accelerates. So it accelerates or increases the growth. The growth of skin cells. The growth of skin cells, resulting in thick, very important, thick, and then red, and then scaly patches. So I can quickly show you. So this is example of psoriasis photos, like the back of the skin of this ready. Yes. So at the back of the head, yes. So this is the definition. So is a chronic skin disease or disorder that accelerates the growth cycle of skin cells, resulting in thick red skull patches. So there are different types. So types of psoriasis, very important. So we have plaque psoriasis. So this is the most common type. Most common type is characterized by raised red patches. Covered with a silvery white buildup of dead skin cells. So it's covered by covered with red patches. Covered with silvery white buildup of dead skin cells. Yes. So plaque psoriasis, and then the other example is what we call gutted psoriasis. So gutted is characterized by small dot like lesions often triggered by strep throat. Very important. And then the third type is called inverse psoriasis. So how does inverse psoriasis present? Red lesions. So very important. Red lesions in skin folds, e.g. armpit, groin. So usually it covers the armpits and then groin. So what is a groin? So groin is basically area of the body where the abdomen meet the thighs. And then the other type is basically what you call pustular psoriasis. So it's characterized by white pustules, or in other words, blisters of non-infectious pus. So white patches. So these are basically blisters of non-infectious pus. Non-infectious PUS, and then surrounded. So there's white, actually not white patches, white PUS PUSTLES, pustules. Yep. So pustules surrounded by red skin. Yep. So the other type is called the erythrodermic. So it's called so this, it should be the fifth one. It's called actually, let me write it properly. So it's called erythrodermic. Yeah, something to do with the skin. So erythrodermic psoriasis. So this is severe redness. So this is severe redness covering. So it is characterized by severe redness covering, large, rare. Yes, and this can be very life-threatening. Yep. So let's talk of what we call etiology, including triggers. Yeah, so infections. So triggers, so infections such as strep throat can trigger this. And then with skin injuries. So we have to understand that psoriasis, a quick recap, is autoimmune. So meaning the normal immune system of the body fights the skin. Instead of protecting it, it fights. So these are triggers. So skin injuries, so cuts, scrapes, bumps. Yes, so cuts and then scrapes can trigger this. And also under skin injuries, we have stress, cold weather. Yep. No, actually, these are independent factors. Sorry. So stress can trigger, and also cold weather, and then smoking, and excessive drinking of alcohol consumption. Yeah. So drugs like lithium, beta blockers, this can trigger, not really causing. Yeah. So, and also there's a genetic predisposition, so hereditary, or you can say genetic. Yep. So there are some genes which have been found to be linked with psoriasis. And also other triggers, we have also hormonal changes. Fluctuation during puberty, especially, like fluctuation during puberty and menopause can trigger psoriasis. And then obesity. So how do you define obesity? Obesity is basically abnormal body weight. So how do we find this? We usually find this through what we call BMI. So that is body, M is max, I index. So how do you calculate BMI? BMI is equal to weight. So I'll just pick kg over height, and then you square height, and then you, what are the units? So they're saying below 18.5 kg per meter squared. So height is in meters. Yes, so below this is the underweight, and then they're saying between 18.5 to 25.4 is normal weight. And then 25 to less than 30 is overweight. So other they say pre-obesity, and then 30 and above is obesity, so abnormal. Yep. So these are the values. So obesity can worsen and challenge treatment actually, and also diet. So like they're saying, certain diet can influence symptoms. So what is the pathogenesis? So pathophysiology, how psoriasis occurs, pathophysiology. So number one is T cells. This is a component of the immune system. T cell immune system mistakenly attack healthy skin cells, leading to rapid skin cell production. So this attacks skin cells mistakenly, so leading to what we call rapid and abnormal skin cell production. Yep. So normally the skin, normally skin cells take weeks to mature and shed. However, in psoriasis, this process occurs in days, resulting in a buildup of cells. So normally skin cells takes weeks to mature and shed. So but in psoriasis, this process occurs in days, resulting in buildup of cells. So occurs in days. So this is abnormal. So this is just a summary of pathophysiology. So clinical presentation. So clinical presentation of psoriasis. Clinical presentation of psoriasis. Okay. So psoriasis can present as clinical presentation. So it can present as red patches of skin covered with thick silvery scales. Dry cracked skin. So dry cracked skin that may bleed. So this can cause bleeding. And so there's also itching, burning, and soreness. There's itching, burning, and soreness, and then thicken and thicken or ridged nails, swollen and stiff joints associated with psoriatic arthritis. So also there's what we call swollen and stiff joints. So this is associated with what we call psoriatic arthritis. Arthritis is the inflammation of the joints. Inflammation of the joints. Yep, so it's called psoriatic arthritis. Quickly, how can we treat? So treatment, very important. Number one, we give topical treatment. What do we give? Corticosteroids such as hydrocortisone, topical, and then we can give triamcinolone, acetone. So this is a medium potent. So this is a medium potent.